I am Dr. Robert Sentongo. I'm a senior consultant plastic surgeon in charge of plastic surgery services in Mulago Hospital. Mulago Hospital is the highest institution of healthcare in this country. And today we are talking about a condition that some children are born with called cleft lip and cleft palate. We recognize it by seeing defects over the head, face, and sometimes the neck, but mainly the head and the face, where the eyes, nose, and mouth are. In Uganda, we have approximately 1,000 children born per year with clefts. Unfortunately, not all of them are born in hospital, and not all of them survive the first few days of their life if their condition is grave and they are not born where care can be given. Until about 10 years ago, Uganda did not have much of what we call local capacity to repair this. So we've been depending on visitors from the developed world to come and do these surgeries for us. Over the years, among the friends we've associated with is Mr. Brian Samalad. He initially came in as an individual volunteer, but he has subsequently been coming under sponsorship of an organization called CLEFT, C-L-E-F-T. And this organization has sponsored some people from here to go and participate in international conferences where we have shared ideas and experiences with centers that are better in terms of quality, in terms of follow-up and patient management, but has also sponsored Mr. Brian Samalad with teams to come and help us with the more complex operations. Now, the initial treatments involve mainly closing the defect, but functionality, after closing the lip, after closing the palate, the child may not be able to speak unless if speech therapy has been given. The child may not be able to speak intelligibly unless if he has been taught how to speak. And some defects require a kind of technology that we do not have yet in Uganda. Two, as we talk now, we are 6 who can do this. And unfortunately, the majority of them are in Mulago, and one is in Kosu, in Chisubi. The district hospital, up to now, we don't have a surgeon. So whereas we are training, and more people will be training, but we need to rapidly scale up this capacity by increasing the capacity of the individual hospitals to handle this. But as we talk now, the tendency, especially of surgical services, are towards what we call life-saving procedures or emergency procedures. Road traffic accidents, falls, obstructed labor, things like that. And that's where the majority of the resources go. And since this does not physically pain, the tendency is 1, for the parents not to show up, 2, for the population not to care because the parents have hidden the children, and 3, the general unawareness and the blame game of saying whoever is born lame has a curse on him. Many cultures in this country associate these clefts with a bad omen. The cattle keeping community say that whatever ate the face is going to eat the cows. So they traditionally just abandon this child and the child dies. Some communities just throw the child to the hyenas to eat because if you keep the child in the family, more children will be born with that. Because of the social stigma, many of them just abandon the child for the child to die. So somebody has to go out in the village and fish out this child who is normally hidden and bring this one to correction. But if one is corrected, then that community starts to realize that the correction can be done and more can come. So the challenges we have up to now is, 1, of educating the masses that this can be done and correction can be done almost to perfection. 2, the majority of these tend to be far away from the cities. And these are communities where coming to town is a big problem, even for any other need, leave alone this. Facilitating these parents and the children to reach the facility where treatment can be given. 3, following up these children. As we talk now, most of the children that have been born that we have landed our hands on have been corrected at least once. But most of them require more than 1 operation. And this follow-up and the technology required to produce perfect results is still lacking in this country. And this is why it's very important at this moment in time to make sure that everybody knows that something can be done, and something can be done significantly better if we get better equipped. So these are some of the issues that we'll be happy to receive or be helped with organizations like CLEFT.